Taking you even further into the philosophy behind SHAPE, once again, the target of health was developed over decades of clinical experience working with thousands of patients suffering with simple to complex health conditions. You will notice at the center of the target is what we refer to as the bullseyes. Most healthcare professionals shoot for a bullseye first when they begin treating you. Not only do they try to fix what you're bringing to their attention, they also try to fix what they deem most important. If you present with cancer or diabetes, you want a doctor with this specific bullseye mentality, and rightfully so. Now let's be practical. What if you present with severe indigestion, fatigue, insomnia, low back pain, and headaches? May I say this is quite the typical patient. Where does the practitioner start? One must have a system of analysis by which to assess and treat this type of patient. Dr. Frisch's began with the target of health. On the outside ring of his target is pH. If your pH is out of balance, you simply don't heal adequately, no matter what symptomatology picture exists. Most patients with a pH problem are acidic, and we would be so bold as to say 90% are at this end of the spectrum. The remaining patients are too alkaline. This is the very first imbalance we need to correct. Being acidic increases a long list of health symptoms. Simply balancing pH will decrease many of the complaints we see daily in our offices, such as common aches and pains, muscle cramping, fluid retention, and excess mucus production. It is sad to see all the females who are being diagnosed with fibromyalgia today. Once we begin working with them and address the fact that they are acidic, many of the muscle complaints they are suffering with will disappear. Embracing a healthier lifestyle will make a tremendous difference for many who are simply acidic. Unfortunately, being too alkaline also increases its own list of negative symptoms. Although this is rarely seen, our practitioners have been taught how to treat high alkalinity as well. Because we believe pH balance is so important, we offer pH concentrated minerals to all practitioners. Understanding the importance of pH in its contribution to lessening many of the common symptoms people suffer with today, we suggest adding pH concentrated minerals to your water, which will make a tremendous difference toward restoring pH balance. The next ring on Dr. Todd's target is stress management. If you don't or can't adapt to stresses in your life, you cannot heal. Statistics state that 78 to 90% of all health complaints that are seen in doctors' offices today are stress-related. If you are maladapting to stress, it will be difficult to heal. This must be addressed early in your treatment program. The question isn't, are you under stress or not? We all are. Rather, the question is, do you adapt or maladapt to stress? Western or allopathic medicine's approach to stress is either medication or counseling. While we believe there is great benefit to using both when appropriate, we feel it is important to first look at stress from a physiological viewpoint. Physiologically, stress is interpreted in the hypothalamus, which represents the nervous system, and it will communicate through chemical messengers with the pituitary gland, which represents the endocrine system. It is really the only place these two vital systems communicate. It is a profound connection. The hypothalamus and pituitary will talk the stress over, then send a message to the adrenal glands. The adrenal gland's job is to physiologically deal with the stress by pumping out adrenaline and cortisol. We are all familiar with the primary reaction of fight or flight, but the secondary reaction is to increase cortisol. Cortisol is your stress hormone. Let me digress here and explain our thoughts on treating hormones with natural and/or prescription medicine. There are 3 rules to follow. Never replace something that's not missing. Giving a female estrogen without adequate testing is dangerous and commonly prescribed. Bad idea. Replace hormones with substances as close to those chemicals that the body naturally manufactures. This is the current bioidentical hormone theory. Monitor by appropriate testing procedures. There is a huge percent of our female population using bioidentical hormones. The only true bioidentical hormone are those produced by the body. We can only mimic those hormones. Extensive research is ongoing and is producing very favorable results. Most of these products, however, are prescription. It is not only wise, but essential to retest hormone levels after a certain amount of time has passed when taking hormone replacement therapy. The adrenal gland also produces DHEA. DHEA is the fountain of youth hormone and has been completely and utterly misused. DHEA gives you energy, increases your sex drive, and helps you convert fat to lean body mass. It would seem obvious that everyone should be taking this wonderful hormone, but this can really mess up a patient metabolically. DHEA is a precursor to testosterone and estrogen. We cannot tell DHEA which of these hormones to produce. Never take DHEA without testing hormone levels first. Regarding the physiology of stress, the key is not to focus on cortisol and/or DHEA, but to focus on the cortisol to DHEA ratio. If this ratio is skewed, you most definitely will maladapt to stress. How this maladaptation occurs will depend on what part of the body is affected. Let me detail 5 different areas: the brain, the digestive system, the pancreas, the immune system, and inflammation throughout. Many other areas can be affected, but focusing on these primary areas cover most of what walks into our practitioners' offices every day. Keep uppermost in mind, it's all about the cortisol to DHEA ratio. If the ratio imbalance affects the brain, you will observe decreased levels of serotonin. Dopamine, GABA, and acetylcholine will also be affected. Clinically, you will begin to see problems with sleep, increased depression and/or anxiety, and potential problems with ADD, ADHD. If the ratio affects the stomach, you will see a decreased production of hydrochloric acid or HCl. This will lead to many digestive problems, including irritable bowel syndrome, IBS, hiatal hernia, inflammatory bowel disease, and even food sensitivities. If the ratio is skewed, you will see heightened inflammation in the body. Virtually any medical term that ends in itis can occur. Arthritis, bursitis, tendinitis, gastritis, sinusitis, bronchitis, dermatitis are just a smattering of symptoms that can happen in the body when the cortisol to DHEA imbalance affects the inflammatory cascade. Every practitioner's office is flooded with these complaints. Are NSAIDs, prednisone, or Celebrex the only options to treat inflammation? Absolutely not. If this ratio imbalance affects the pancreas, its domino effect can be devastating. As you know, the pancreas secretes insulin. Insulin, of course, has a huge influence on carbohydrate metabolism. Insulin will take carbs either into energy production or put it into storage. When stress affects the pancreas, the first thing you notice is a decrease in energy and an increased craving for carbohydrates. This is often referred to as insulin resistance. If this continues, eventually carbohydrates will get shunted into the storage mechanism. You store these carbs in 2 ways. One way will be an increase in lipids. Therefore, your cholesterol and especially triglycerides will become elevated. The other is to simply build fat cells to store these excess carbohydrates. For the male, this fat is typically stored in the abdomen and neck. Excess abdominal weight statistically shows as an increased potential for diabetes and benign prostatic hypertrophy, or BPH. Increased neck size correlates to sleep apnea. Heart disease is an obvious result. For the female, this fat gets stored in the abdomen, hips, and triceps. Flabby triceps can also indicate estrogen dominance. Literally, under enough stress, you can not eat and still gain weight. Disturbing, isn't it? I cannot tell you the number of female patients who do everything right nutritionally, exercise extensively, and yet still gain weight. For years, Dr. Todd believed they were not being honest. He was convinced they were sneaking cookies and such. After researching the physiology of stress, he completely understood how this could happen. If this ratio affects the immune system, you will see this system suppressed. This can have a devastating effect. Increased infections are common, allergic reactions are increased, but the most common thing you will see is an increase in yeast overgrowth. Vaginitis, jock itch, nail fungus, and athlete's foot are commonly seen in every practice. Allopathic medicine will treat these conditions with a myriad of suppressive medications. Simply adding a good probiotic to your supplement regimen can profoundly enhance your immune system. If this imbalance occurs for a long enough period, you will begin to observe what is now called chronic fatigue syndrome, or CFS. This entity was ignored and laughed at by the allopathic community for years. Anyone treating CFS will quickly realize how difficult this condition is to manage. When you understand the physiology of stress, you will make a huge leap into understanding how your health declined. Now digging deeper into stress management, you can see the hypothalamus, pituitary, and adrenals will form an alliance called the HPA axis. This axis is an important mechanism in coping with stress. There is also an HPO axis, ovary, HPT axis, thyroid, HPP axis, pancreas, and on and on and on. The significant point is the hypothalamus. Anything that can be done to enhance its function will have a dramatic effect on the entire body. The function of the hypothalamus can be recalibrated using shape drops. Shedding toxic weight through shape is a wonderful outcome, but the potential it has to influence so many other areas of the body is exceptional. After stress takes its toll on your brain, stomach, immune, inflammation system, or your pancreas, it then invites the nervous system in to combat the stress. The nervous system is basically divided into two parts. The peripheral system, which is what we can control voluntarily, and the autonomic nervous system, which you don't have voluntary control over at all. It is this autonomic nervous system that affords us a window into understanding the physiology of stress on a deeper level. The autonomic nervous system is further divided into two parts: the parasympathetic nervous system, which basically slows us down, and the sympathetic nervous system, which speeds us up, as you can see from the list of body functions on this slide. When you maladapt to stress, you will see an interesting cascade of events. Let's review sympathetic dominance. It is normal to be sympathetic dominant when the stressors in your life cause this to occur. Using Dr. Todd's favorite example, suppose you're hiking in Yellowstone Park and a grizzly bear comes lumbering down your path. Your body will immediately go into sympathetic dominance. Your pupils will enlarge to increase your visual field. Your mouth will become dry due to fear. Your heart rate will increase in an effort to pump more oxygen to your extremities so you can run faster, and your digestive system will shut down. This is a normal response to the stress before you. However, suppose you go into sympathetic dominance when nothing comes close to a grizzly bear encounter. This would be an inappropriate response. In this day of incredibly high stress, practitioners are seeing sympathetic dominance rearing its ugly head with such a degree of frequency that it is becoming commonplace. Magnesium will downregulate the sympathetic nervous system, whereas potassium will upregulate the parasympathetic nervous system. This treatment is very effective. Once again, pH concentrated minerals will help to balance pH, alleviating many of these symptoms. However, the most significant aspect that occurs when you are in a sympathetic dominant state is that you will become acidic. So let's go back to Dr. Todd's target of health. Do you remember what is the outer ring of his target? Yes, you saw this slide earlier, but we wanted to bring it back to your attention once again. What goes around comes around. We started with pH with our target of health, and we end with pH being a maladaptation of the stress model. SHAPE practitioners consistently test urine while you're in phase 1 and will make the necessary recommendations, all while working toward balancing pH, along with 9 other metabolic markers. The third tier of the target of health deals with detoxification and digestion. If the liver is not functioning up to par, again, your ability to heal is compromised. The liver has approximately 400 major functions according to most authorities. Half of the functions deal with digestion, and the other half deal with detoxification. Healthy detoxification is of utmost importance when managing any chronically ill patient. Every practitioner should have an armory of detox techniques they feel comfortable recommending. We have clinically observed your ability to heal is lessened dramatically if your liver is not functioning to the best of its ability. If detoxification pathways are compromised or downregulated, the potential for metabolic disorders are increased. The process of detoxification involves much more than the liver. It is important to realize we simply cannot avoid toxins. Our world is exceedingly toxic and becoming more so with each passing decade. Fortunately, our Creator put a system in our body that can deal with or self-regulate how it removes or eliminates toxic substances. Even though you have this miraculous system that handles toxic substances, it can become overloaded. Your body will begin to break down and develop symptoms that run the gamut from simple to serious or acute to chronic. I will explain the theory of homotoxicology in our final video. The fourth ring of Dr. Todd's target represents our immune function. Unfortunately, the standard American diet, or SAD, is inflammatory and immunosuppressive. If we can convince you to end the madness of consuming man-made foods and embrace an 80-20 mentality, meaning 80% whole food, food that has the ability to rot or spoil, food that God created to repair, rebuild, and sustain vibrant health, then we are one step closer to turning the tide on the horrific health epidemic in our country. It's no secret a weakened immune system means a more susceptible host or body. When the immune system is not functioning as it was intended, illnesses from recurring infections to named diseases take over. We are all familiar with acute infections and understand the benefit of allopathic medicine's ability to treat common infections. Unfortunately, mainstream medicine tends to mistreat and often uses an excess of antibiotics that lead to an overgrowth of yeast. Antibiotics are very effective for acute infections. However, overuse can lead to chronic candidiasis in medical terms, and that alone can overwhelm the immune system's ability to do its job. SHAPE's program is anti-inflammatory and antifungal in nature, thereby contributing to improved immune function. With the advancements in allopathic medicine and its understanding of our complex immune system, we have tests that can measure different aspects of our immune system. SHAPE practitioners are trained to recognize the subtle imbalances of the system and have supportive options in their armory to strengthen and improve immune function. This sums it up, folks. SHAPE ReClaimed was developed and has been effective in achieving dramatic improvement throughout the target of health. When we balance pH, strengthen adrenal function, improve digestion and detoxification, and enhance immune function, then your pH raises, considering the majority of our population is acidic. Your adrenals handle stress more efficiently. Your digestion improves dramatically, meaning you are less dependent on proton pump inhibitors or PPIs. Your blood sugar levels stabilize. You become less dependent on prescription meds to manage your symptoms and diseases. And your immune system starts doing the job it was created to do. So let's go back to the beginning of our discussion regarding this insightful target of health. Remember me saying you will notice in the center of the target is what we refer to as the bullseyes? What do we treat first? We start with shape drops because we know we will resolve many of the common complaints by simply detox and cleansing you first and foremost. We help you to incorporate an anti-inflammatory and immuno-enhancing diet. We address underlying weaknesses, and we work tirelessly to convince you that you need to change. You need to embrace a healthier lifestyle if you want to restore your health.